Hi, how are you? Um,
Hello, I'm good. Thank you so much for having us.
yeah, it's a pleasure. Yeah, so my name is Sing Song. I'm like an exec of Ignite Science, and we just have all our execs here to listen to the presentation today. So thank you so much for giving us a presentation.
Awesome. Okay, great. Then I'll get started. Hello everyone. My name is Priyanka Senthil, and I'm a member of the American Lung Cancer Screening Initiative, or ALCSI as we like to call it. So today we'll be giving a presentation on lung cancer and lung cancer screening. And we're really grateful to Ignite Science for giving us the opportunity to present to you today. So before I get into the content of the presentation, I'd like to share a little bit about what the American Lung Cancer Screening Initiative does. So ALCSI is a 501c3 nonprofit that works to raise awareness for lung cancer and lung cancer screening. And so we are a team of over 50 passionate students and doctors located across the United States. And we've worked with community organizations like the South Asia Network and American Indian Cancer Foundation, as well as city and health departments, including the New York City and Connecticut health departments. So essentially, we hope that in educating communities about lung cancer and lung cancer screening, high-risk community members will be encouraged to seek lung cancer screening. So if you are interested in learning more about ALCSI, we'd like to invite you to visit our website at www.alci.org, and please email us with any questions at any time. So to start things off, lung cancer is very common. It is the second most common cancer in the US, excluding skin cancer. It is also the most fatal. So this graph shows the American Cancer Society estimates for the number of new cancer cases in the United States. And this graph estimates new cancer cases in 2020 for the four most common cancers. And as you can see, it was estimated that 228,820 people were diagnosed with lung cancer in 2020 in the US. So to put this number into perspective, it is estimated that about 6% of people will develop lung cancer during their lifetime in the United States. That means 1 in every 15 men and 1 in every 17 women will be diagnosed with lung cancer. Moreover, not only is lung cancer very common, but it is also very fatal. Lung cancer is a leading cause of cancer-related death in the US and the world. So to go further, in 2020, it was estimated that lung cancer claimed the lives of 135,720 people. And this graph shows the American Cancer Society estimates for the number of cancer-related deaths in the United States. And as you can see, lung cancer is far more fatal than breast, prostate, and colon cancer, causing more deaths than even all three of those combined. So every year, even though there are about 50,000 more new cases of breast cancer, there are still 90,000 more deaths due to lung cancer. And in women alone, every year, lung cancer causes more deaths than breast, ovarian, and uterine cancer combined. So if we look at lung cancer incidence and mortality by sex and race, you can see that among males, lung cancer incidence is highest in Black males at an incidence rate of about 71.7 per 100,000 people. And among females, lung cancer incidence is highest in white females at an incidence rate of 44.7. And as you can imagine, mortality rates mirror incidence rates. So Black males have the highest mortality rate amongst males, while white females have the highest mortality rate amongst females. So from this data, the question that arises is, why is lung cancer mortality so high? Well, lung cancer mortality is so high because patients are typically diagnosed at a later stage. So this graph is looking at the proportion of patients with lung cancer by stage. And stage is simply a way for doctors to classify a cancerous tumor based on tumor size. And some other factors also are whether the cancer has spread to lymph nodes and if the cancer has spread to other locations in the patient's body. So all of these factors will determine stage. Currently, most lung cancers are diagnosed at a distant stage when the cancer is already spread beyond the site in the lung at which it originated. And this graph is based off of data from 2008 to 2017 published by the National Cancer Institute. And as you can see, about 21% of patients are diagnosed at a localized stage, while the majority of patients, about 51%, are diagnosed at a distant stage when the cancer is already spread to other locations in the body. So why is this important? Well, it's important because the stage that lung cancer is diagnosed at directly correlates with survival. And we'll see this in the next slide. So as we were talking about, one way that doctors track survival is by looking at something called a 5-year survival. And as you can see here, the 5-year survival for lung cancer at the early stages is high, which is what we would expect. But the 5-year survival significantly drops as the disease progresses. This graph is simply another way to understand the relationship between stage at diagnosis and 5-year survival. The 5-year survival for patients with localized lung cancer is about 59%, but only 23% of lung cancers are diagnosed at that stage. In comparison, the majority of lung cancers are diagnosed at a distant stage. And this is why early detection of lung cancer is so important, because if we can detect lung cancer at an early stage, then treatment options are going to be better and prognosis will also be better. With lung cancer being such a morbid disease, some of you might be wondering, why is the majority of lung cancers diagnosed at a later stage? Well, the majority of patients are diagnosed with late-stage lung cancer because they don't start feeling any of the symptoms of lung cancer until the cancer is already grown and spread. And the most common symptoms of lung cancer are chronic cough, coughing up blood, chest pain, and shortness of breath. And some additional symptoms may include hoarseness, loss of appetite, fatigue, and persistent lower respiratory infections. However, when people become symptomatic, the cancer is usually already grown and spread to a point where it is more difficult to treat and the prognosis is poor. So this brings up another challenge. If the diagnosis of lung cancer has to wait until the patient has symptoms, then it's going to be difficult to catch the lung cancer early. So the next question we ask is, how do we catch lung cancer early if patients are asymptomatic? And one of the best ways we can do this is through lung cancer screening. And that's what we'll talk about for the rest of this presentation. Lung cancer screening is done using something called the low-dose computed tomography scan, also known as CT. So if you're eligible for lung cancer screening, it is recommended that you get an annual lung cancer screening test. And in the coming slides, we will discuss what lung cancer screening is, who should get screened, and how you can get screened. So first of all, an important distinction that we want to make is that lung cancer screening is done using the low-dose computed tomography or low-dose CT scan, and not the chest X-ray. We use low-dose CT because it provides more detailed pictures than chest X-ray and is better at finding small abnormal areas in the lungs. So the picture on the left is a picture of a chest X-ray, and the yellow arrows point to the abnormal area in the lungs. But as you can see, it's a bit unclear. On the other hand, the image on the right is a picture of a low-dose CT scan of the chest, and the red arrows point to the abnormal areas in the lungs. And as you can see, this image is more detailed than the chest X-ray, so that's why low-dose CT is more preferred. And the question that researchers wanted to answer is, how effective is low-dose CT scan at detecting lung cancers in an early stage? And an important lung cancer screening trial is called the National Lung Screening Trial, or the NLST. And they tried to answer this very question. So the NLST, like I mentioned, was a large national study with over 50,000 patients. And the goal of the study was mainly to determine the effectiveness of using low-dose CT to detect lung cancer in patients considered high risk for lung cancer. So the study included two main groups. One group of patients received annual low-dose CT scans, and one group of patients received the annual chest X-ray that we talked about. So by comparing the stages at which cancers were caught between these two groups, the study wanted to determine if low-dose CT scan was better at catching more lung cancers at an early age when compared to chest X-ray. So these are the results, and as you can see, of everyone diagnosed with lung cancer, the low-dose CT scan caught the most lung cancers at an early stage, while the chest X-ray diagnosed more patients at stage 4. And this has important implications for survival, as we've talked about already. Because the low-dose CT scan caught more lung cancers at an early stage, these cancers were more likely to be treatable, and therefore the prognosis was also better. And in fact, this translates to a 20% reduction in mortality for those who underwent lung cancer screening using low-dose CT compared to chest X-ray, which is astonishing. However, a concern with any screening test is accuracy. Essentially, how good is a low-dose CT scan at catching lung cancer? So for every 100 individuals undergoing CT screening, 75 will be negative. And of those 75 that are negative, 97.7 to 100% truly do not have lung cancer. So this means that the test is very good at identifying people who do not have lung cancer. That is, if you do have lung cancer, the test will most likely come back positive and will not miss your cancer. So if we move our attention now to the 25 individuals that are positive, then 23 turn out to be negative for cancer, primarily with follow-up imaging alone. So this means that even if your test result is a false positive, it's really easy to rule out cancer using further non-invasive imaging. And the 2 individuals that do have a positive test result and truly do have lung cancer are more likely to be diagnosed at an early stage than if they were not to undergo lung cancer screening. So this means that, as we've mentioned many times before, their treatment and prognosis will both be better. And so the results of the NLST were published in 2011, so 10 years ago. And several studies have been published since then, further confirming the life-saving benefit of lung cancer screening in high-risk populations. And one of the most important trials is the Nelson trial. And we'll talk about this one in this slide. So in February of 2020, the results of the Nelson trial were published. And like the NLST, the Nelson trial had 2 groups. However, unlike the NLST, the Nelson had a group that received low-dose CT and a group that received no screening of any kind. And a total of 13,195 men and 2,594 women between the ages of 50 and 74 were randomly assigned to undergo CT screening at T0, which is baseline, year 1, year 3, and year 5.5. Or if the patients were in the no screening group, then they received no screening at all. And the results of the Nelson trial also confirm the life-saving benefits of lung cancer screening by low-dose CT. In the screening group, 58.6% of lung cancers were diagnosed at stage 1, which, if we recall, is much higher than the rate without screening. And in the non-screening group, 13.5% of lung cancers were diagnosed at stage 1. And so early detection translates to a reduction in mortality, as you can imagine. So in the low-dose CT group, there was a 24% reduction in lung cancer mortality in men and a 33% reduction in lung cancer mortality in women when compared to no screening. So in addition to the NLST, the Nelson trial also showed that improvements with low-dose CT technology, the false positive rate could be significantly reduced. So we now know that lung cancer screening significantly reduces lung cancer mortality. But you guys still might be wondering who should get screened for lung cancer. The United States Preventative Services Task Force, also known as the USPSTF, sets guidelines for who should be screened for lung cancer. Right now, they recommend that people between the ages of 50 to 80 who have a 20-pack year smoking history or greater, and who are current or former smokers who quit within the past 15 years, get annual low-dose CT scans. So the current screening guidelines require you to have a 20-pack year smoking history. Now, pack year might not be a term that many of you are familiar with, but it's simply just a term for a way for doctors to track your smoking history over a period of time. So in this diagram, it shows that a pack year is defined as smoking a pack of cigarettes per day for a year. So for example, if you were to smoke 1 pack a day for 20 years, that would equate to a 20-pack year smoking history. Alternatively, if you were to smoke 2 packs a day for 10 years, that would also equate to a 20-pack year smoking history. So the important takeaway here is that there are many different ways to reach 20 pack years, and the pack year is simply a way for doctors to help keep track of your smoking history. And another important point that I want to make is that the USPSTF guidelines were recently updated. So the USPSTF guidelines had slightly different guidelines just about 3 months ago and updated their screening guidelines in March 9th of 2021. So the previous screening guidelines only recommended that individuals between the ages of 55 and 80 with a 30-pack year smoking history or more get screened. So under the new guidelines, the age bound is lowered from 55 to 50, and the pack year smoking history is lowered from 30 pack years to 20 pack years. So as you can imagine, these new guidelines will nearly double the number of eligible patients for lung cancer screening in the United States. And notably, the most apparent increases in eligibility will occur among women and minorities. So, however, while these new guidelines will include more high-risk individuals, they only include individuals with heavy smoking histories. There are, however, other risk factors for lung cancer that are not accounted for in the current screening guidelines, which is a major drawback. And these additional risk factors include things like exposure to secondhand smoke, exposure to radon, exposure to asbestos, a family history of lung cancer, COPD, and previous radiation therapy to the lungs. So it is important that we recognize these additional risk factors. While lung cancer does have a strong association with smoking, there are still a large number of people in the United States and the world who have never smoked that still get lung cancer. So never smokers are defined as individuals who have smoked less than 100 cigarettes in their lifetime. Because lung cancer has such a strong association with smoking, people are often surprised to learn that lung cancer never smokers accounts for about 10 to 20% of lung cancer diagnoses and is the seventh leading cause of cancer-related death in the US and the world. So more never smokers die from lung cancer each year than people die from ovarian cancer. And this graph shows the proportion of lung cancer cases that occur in people who have smoked in their life and people who have never smoked. And it is also further broken down by whether they're current, former, or never smokers. So as you can see, 80 to 90% of lung cancers occur in people who have smoked during their lifetime. But 10 to 20% occur in never smokers. And interestingly, women are more likely to be never smokers when diagnosed with lung cancer. And in fact, in the US, 60 to 70% of never smokers diagnosed with lung cancer are women. So as I mentioned before, right now, lung cancer screening is not recommended for individuals who have never smoked. However, understanding lung cancer in never smokers is a current focus of research. With the development of new screening technologies and risk models, there may be a way to identify high-risk never smokers who should also be screened for lung cancer. So just to summarize real quick, lung cancer is the leading cause of cancer-related death in the US, and it is so deadly because most lung cancers are diagnosed at a late stage when it has already spread to other locations in the body. Importantly, early detection using lung cancer screening with CT, with low-dose CT, can significantly reduce lung cancer mortality. And the studies that we've looked at have shown that CT screening can reduce lung cancer mortality by up to 33%. However, one of the setbacks right now is that currently only 5.7% of high-risk individuals are getting screened for lung cancer. So to highlight how low this number really is, in this slide, we compare lung cancer screening rate to the screening rates for breast, cervical, and colon cancer. All four of these cancers have screening tests that are recommended by the USPSTF. But right now, only 5.7% of high-risk individuals are currently getting screened for lung cancer. This rate is extremely low in comparison to the screening rates for breast, cervical, and colon cancer. And the American Lung Association estimates that if we were to screen every high-risk individual recommended by the USPSTF in the US for lung cancer, we would save 48,000 lives. However, we are only screening 5.7%, which means that a lot of lives that could be saved are not being saved. So why is that? Well, the lung cancer screening rate is low for a number of reasons, including limited awareness and concerns about access to screening, the cost of screening, and the safety of screening. So in the next slides, we will discuss each of these topics. But the important takeaway right now is that lung cancer screening can help reduce an individual's risk of dying from lung cancer. So the first potential concern that we will address is the cost of lung cancer screening. The average low-dose CT scan costs anywhere from $300 to $400, but most insurance companies, including Medicare and Medicaid, will cover the cost for eligible patients. However, there are a few exceptions. One, Medicare will only cover lung cancer screening until the age of 77. 2, not all state Medicaid plans cover lung cancer screening. And 3, patients will still pay the usual fees for provider appointments before or after the scan. And as I just mentioned, unfortunately, not all state Medicaid plans cover lung cancer screening. Here's a map updated in July showing which state Medicaid plans do and do not cover lung cancer screening. Blue states have state Medicaid plans that cover lung cancer screening, and the purple states do not have lung cancer screening. And the pink states don't have this particular information available. So the first step to getting a patient screened for lung cancer is having them talk to their primary care physician or a primary care provider. So there are certain questions that a primary care provider has to ask and topics that need to be discussed. And one of these is the patient's pack your smoking history, which we saw how to calculate in earlier slides. And to find accredited lung cancer screening centers, patients can go to the American College of Radiology website, and they can type in the state or city they live in to see where accredited lung cancer screening facilities are located near them. The American College of Radiology website is listed on the bottom left-hand side of the screen. And this is a map of accredited lung cancer screening facilities in Massachusetts. As you can see, each red pin represents an accredited screening center. So many of you might be wondering about the experience of getting a low-dose CT scan. As far as experience goes, it will require you to lay on your back for about 5 minutes, and you'll be doing something very similar to what the patient in the photo is doing here. One thing to note is that this process will not hurt at all because this is a low-dose CT scan and you do not use contrast. So this means that there will not be any needles or injections involved. The low-dose CT scan is non-invasive, fast, and completely pain-free. Additionally, the amount of radiation exposure from a CT scan is very low. And a way that doctors measure the amount of radiation a patient may receive is through a unit called the millisievert. So it is just a way to measure radiation and compare the levels of radiation received during different activities and over time. So for a low-dose CT scan, you'll be exposed to 1.5 to 2 millisieverts of radiation. This is a lot lower than a full chest X-ray, which will require a radiation dose of 8 millisieverts. So to put that in perspective, you are exposed to about 3.11 millisieverts of radiation a year just from breathing cosmic radiation, eating, and the radiation from the earth. So a low-dose CT scan exposes you to less radiation than you are exposed to from just existing on Earth, which means that the level of radiation that you receive from an annual lung cancer screening test is very small. That being said, if this is a concern to patients, they can always discuss this with their primary care provider. Okay, so now a patient has talked with their primary care doctor and the PCP has referred the patient to a screening center and they receive a low-dose CT scan. So what's next after that? Well, the doctor will receive the results of the patient's screening test and will follow up with the patient to go over the results. And as far as results go, there are 3 most likely outcomes. The first outcome is that the scans are normal. And if this is the case, then the patient should look to get repeat scans in a year. If the scans are abnormal but probably benign, then the patient should talk to their doctor about the next steps. And this may include more scans, tests, or biopsies. If the scans are abnormal and suspicious, then the patient will most likely have to undergo additional testing, such as a biopsy. Okay, so lung cancer screening saves lives, but a question you may be wondering is, can individuals still get screened for lung cancer during the COVID-19 pandemic? And is it safe to do so? During the pandemic, the number of cancer screenings has decreased significantly. However, lung cancer won't stop because of the pandemic. So if a patient is at high risk for developing lung cancer, it is important that they still get their annual lung cancer screening test. And right now, most hospitals have operating lung cancer screening programs, and patients can wear a mask during the entire lung cancer screening process. So if patients follow the necessary precautions, like wearing a mask, then lung cancer screening during the pandemic is safe. And the pandemic should not deter patients from getting screened for lung cancer. And another question that we often get is, how is vaping and e-cigarette use related to lung cancer risk? Vaping and e-cigarettes are relatively new phenomena and have become more prevalent in the last decade. While the long-term effects of vaping and e-cigarettes are still being studied, it is clear that for individuals who have never smoked before, vaping and e-cigarettes can increase their risk of lung cancer. E-cigarette devices and vaping fluids contain nicotine derivatives and heavy metals, among other chemicals. And these arise as both elements of the e-liquid and as a result of organic reactions in the electronic cigarette device. And various studies demonstrate that in vitro transforming and cytotoxic activity of these derivatives is responsible for the increased lung cancer risk. So, though vaping causes fewer health risks than smoking, it is still not a risk-free activity by any means. Vaping can increase heart rate, decrease air volume in the lungs, and increase airway resistance. Furthermore, e-cigarette device use has been significantly increasing, particularly among young adults and non-smokers. So this makes it an area of significant concern for the future. And additionally, while lung cancer screening has the potential to save many lives, it is important to address smoking cessation in the context of lung cancer screening. So lung cancer screening is not a substitute for smoking cessation. Likewise, smoking cessation is not a substitute for lung cancer screening. Smoking cessation is one of the best ways to prevent lung cancer, and lung cancer screening is one of the best ways to detect lung cancer. So using both is the best way to fight the disease. In fact, for every year after an individual quits smoking, their risk for lung cancer is reduced by 8% to 17%, depending on the kind of lung cancer they have. And another reason that smoking cessation is important is because it is required by Medicare and Medicaid services for lung cancer screening programs. That being said, we do understand that smoking cessation can be difficult, but there are a lot of resources for people trying to quit smoking. And some great programs are the renowned Health and Wellness Quit Smoking Program and the Cancer Coalition's Quit Smoking Program. All right, so as this presentation comes to a conclusion, we want to end on what we, the American Lung Cancer Screening Initiative, are doing to begin the widespread awareness, education, and advocacy efforts necessary to increase the lung cancer screening rate. Lung cancer, as we've talked about, is the deadliest cancer in the world. And while lung cancer screening can save many lives, very few high-risk individuals are currently getting screened. We're working to address all aspects of this issue. We wrote and advocated for House and Senate resolutions expressing support for Lung Cancer Awareness Month and early detection through lung cancer screening. And last December, our Senate resolution was passed by unanimous consent. Additionally, we're working to teach communities across the country about lung cancer and lung cancer screening. So, though lung cancer is the deadliest cancer in the world, by working together, we can overcome it and save millions of lives. And really, it starts with working together to raise awareness and initiate lung cancer screening programs in our own communities. And we believe that educating students about lung cancer and lung cancer screening is crucial to lowering the number of deaths associated with the disease because students greatly impact and influence the healthcare of their parents. And we hope that by educating students about important measures that can be taken, we will not only be able to help the students, but also their family members. So we are so grateful to have the opportunity to present to you today. Thank you so much for your time. We hope that you're able to leave this presentation with a better understanding of lung cancer and the lung cancer screening process. And as we all know, lung cancer is a big problem because it's very common and very fatal. That being said, there are tools that we can use and actions we can take to help reduce lung cancer mortality. So the American Lung Cancer Screening Initiative is always looking to help raise awareness for lung cancer and lung cancer screening. We host a variety of events related to lung cancer screening, and we share upcoming presentations and webinars on our website. So if you have any questions, please feel free to send us an email. And additionally, if you're interested in helping raise awareness for lung cancer screening in your own communities, we would love to work together. So thank you so much for listening. And at this time, I'm happy to open the floor for any questions.
Yeah, thank you so much for your presentation. That was really interesting and insightful. I learned a lot. Thank you so much. I don't have any questions, but yeah, I just want to say thank you.